everyone has a different relationship with food. For some, it's a source of comfort, indulgence, or sustenance. Others can have a negative and even damaging association with food. There is commonly held misconception that eating disorders are a lifestyle. Many are unaware that eating disorders are serious mental health and physical illness that can affect people of all religion and ethnicities. Body weight and shape may also signal an eating disorder. It signifies a person's unhealthy relationship with food. Research has shown that 70 million people internationally live with eating disorders. In US alone, approximately 30 million Americans live with an eating disorder, and it is the third most chronic illness among adolescent females in the United States. So what is an eating disorder? Eating disorders are illnesses that affect a person's relationship with food and body image. People with eating disorders have excessive thoughts of food, their body weight or shape. They also struggle with how to control their intake of food. This illness can affect people of all ages regardless of genders, sexual orientation, and races. Eating disorders frequently appear during teen years or young adulthood, but may also develop during childhood or later life. Studies have shown that teenage girls and young women are more likely than teenage boys and young men to have an eating disorder. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. People with anorexia nervosa, often simply called anorexia, excessively limit calories and place a high value on controlling their weight and shape. They also use extreme efforts that tend to significantly interfere with their lives. People with anorexia are characterized by an abnormally low body weight and intense fear of gaining weight and a distorted perception of weight. They also exhibit impulsive behavior and may also have low self-esteem and struggle with relationships. The efforts people with anorexia take to lose weight, even when underweight, can cause severe health problems. They often equate thinness with self-worth. Some people with this disorder may control calorie intake by vomiting after eating or by misusing laxatives. They may also try to lose weight by exercising excessively. No matter how much weight is lost, the person continues to fear weight gain. The physical signs and symptoms of anorexia nervosa are related to starvation. It may be difficult to notice signs and symptoms because what is considered a low body weight is different for each person, and some individuals may not appear extremely thin. Also, people with anorexia often disguise their thinness, eating habits, or physical problems. The good news is eating disorder is treatable and 60% of patients make a full recovery. However, only 1 in 10 people with an eating disorder will seek and receive treatment. The exact cause of eating disorder is unknown. As with other mental illness, there may be many causes. Researchers are finding that eating disorders are caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. Biological factors such as change in brain chemicals also play a role in developing an eating disorder. Statistics show that 97% of people hospitalized for an eating disorder have a co-occurring health condition. People with eating disorders can often have other mental health disorders such as depression or anxiety or problems with substance abuse. Anorexia, like other eating disorders, can take your life and can be very difficult to overcome. But with treatment, you can gain a better sense of who you are and return to their healthier eating habits and reverse some of the anorexic serious complications. Treatment usually involves a team approach including nutritional support and either cognitive behavioral therapy or interpersonal therapy. These forms of psychotherapy focuses on modifying dysfunctional emotions, behaviors, and thoughts by interrogating and uprooting negative or irrational beliefs. These therapies are considered a solution-oriented form of talk therapy. CBT rests on the idea that thoughts and perceptions influence behavior. Along with CBT, nutritional counselors work as a team to help the individual gain weight while changing their distorted thinking about food and their bodies. Bulimia nervosa is another common eating disorder. Bulimia is characterized by uncontrolled episodes of overeating called binging, followed by compensatory behaviors such as self-induced vomiting, designed to undo or compensate for the effects of binge eating. People with bulimia restrict their intake during the day, which often leads to more binge eating followed by purging. Bulimia nervosa is also treated with CBT or IPT. In IPT, the therapist specifically focuses on interpersonal relationships and believes that if these relationships improve and a person learns to better handle conflict and relational deficits, there will be improvement with behaviors related to bulimia. Many diabetic patients are also found to have an eating disorder and thus struggle with controlling their diabetes, which exposes them to diabetic complications such as heart disease, stroke, neuropathy, loss of vision, and kidney disease. Regardless of how it begins, treatment can be challenging as individuals with type 1 diabetes tend to show higher dropout rates and poorer treatment outcomes than other patients. No matter where someone is in their eating disorder or recovery, a multidisciplinary team is necessary to address the many entangled issues present with diabulimia. The best scenario for a patient is to see the endocrinologist, a dietitian who has a knowledge of both diabetes and eating disorders, and a mental health professional who specializes in eating disorders. The road to recovery from an eating disorder starts with admitting you have a problem. Just as anyone can develop an eating disorder, so too anyone can get better. With proper treatment, including medical and nutritional support, people can recover, find hope, and health again. If you like this video, make sure to give it a thumbs up and subscribe to our channel for more educational content.